Okay.
So it's fine.
Yeah. So we were talking about the score. What are the Roxana Mehran score, and how does it helps doctor assess risk in patient undergoing heart procedures like angioplasty?
Yeah, so I have several risk scores for
Yeah.
patients undergoing angioplasty. And I think you're asking about the CIN, contrast associated acute kidney injury
Yes, ma'am.
risk score, the CIN risk score. And that we developed, the very first version was in 2004, the second one in 2022, I think, when we published in The Lancet. And it's basically a more current version because we've been so good in preventing CIN using these risk scores. It takes patient criteria, procedural criteria, contrast volume, and it gives you a opportunity to calculate the risk of a patient developing acute kidney injury. And why it's important is because acute kidney injury is a very important cause of increased hospital stay, comorbidities, and of course, increasing costs to the healthcare system. But it's also not very good for patients. Those patients who develop AKI end up having higher rates of mortality, both early and late. And so it's a very, very important issue to absolutely know that risk and make sure that you're cognizant in preventive measures that include limiting your contrast volume, assessing the risk of the patient and knowing what they are, stopping nephrotoxic agents, and most importantly, is to hydrate the patient before, during, and after the procedure.
Thank you very much, ma'am. I mean, how does the Roxana Mehran scores help prevent complication, especially bleeding for heart patient on blood thinners?
Yeah, so we have a risk score also for bleeding, and that is not the Roxana Mehran risk score, it's the HBR ARC bleeding risk. And I developed a bleeding risk score from the Acuity trial with Dr. Stone. But this one that I think you're talking about is the HBR ARC score, which it comes from the Academic Research Consortium evaluating patients who are at high risk for bleeding. And those patients also would have if they are left on antiplatelet therapies, if they are high risk, they're actually having a BARC greater than 3. So it's major bleeding of about 4% 1 year after the procedure. And so those are patients with, you get one major criteria or two minor criteria, and you have a high bleeding risk. And those are patients that are elderly, that's a minor criteria, who have had prior bleeding, a major criteria. Those patients who have need non-cardiac surgery or have malignancy or have active cancer, etc. And those patients who have also a very important oral anticoagulant, need for an oral anticoagulant. So you can look that up on, again, this is published in the European Heart Journal as well as in the JACC journal, where you could look up the ARC HBR criteria.
Thank you very much, ma'am. Can you explain how patient with condition like diabetes, kidney disease can benefit from personalized treatment based on this score?
Well, so we're going back now again back to the CIN risk score. So you're going back and forth. The patients who have diabetes and chronic kidney disease, they're additive factors for both acute kidney injury, but also these are the higher risk patient populations who also have high ischemic risk. So you have to be really, really careful about these patients. And I think that knowing that not only do you have ischemic risk, but also kidney risk in these patients puts you at a very, very big alert to make sure that you care for these patients.
Thank you, ma'am. And what advice would you give